everyone. I am Youngdan Cho, an assistant professor in Department of Periodontology in Seoul National University. Welcome to live surgery, which is supported by Dentium. And today's operator is Dr. Jung Park. Actually, he is my senior in the same Department of Periodontology. So today, I am very great honor to be here as a moderator on his live surgery. Let's see the case preview first. Today's surgery is immediate implant placement with breast tissue level implant and the GBR with OSTEON Xeno Collagen. The patient information. He is 49 years old, male, and his cheek complaint is the gum condition is not good, and also he has the mobile tooth. And he didn't have any dental treatment for 10 years. And the present illness is periodontal inflammations and also the severe bone loss on the premolar side. And also he has tooth mobility on the lower anteriors. Let's see the clinical photo and radiographs. Okay, we can see the calculated positions on the lower anteriors, and also the gum has the inflammations and also shows the gingival redness and also gingival recessions. And also we can check the severe bone loss all the way on the anteriors and also the posteriors. Okay, today's Dr. Pearl's surgery plan is to extract on the number, the 31, 32, 41, 42, 43, almost the lower anteriors, and also immediate implant placement on the tooth number 32 and 43, and also the bone graft on the lower anteriors. And his prosthetic plan is 5-unit bridge using the 2 implants featured on 32 and 43 tooth positions. Okay, today he will use the bright tissue rubber implant. It can make us simplify the surgical procedure, and also it can simplify the prosthetic procedures because it has the thin and deep threaded design, so it can make us the easy implant placement, and also it can give us the good initial stability, and also it can make the increase of the bone implant contact area, and also therefore it can preserve the alveolar bone and so make the stable immediate loadings. Let's see the similar case on the implantation on narrow reach with the bright tissue rebel implant. Okay, we can see the no tooth, the missing area on the posterior, and also just 3 teeth on the tooth number 33 and 43 and 44. So he planned the tooth extraction and then placed the implant with a bright tissue rebel on the lower anteriors. So according to the plan, he did the immediate implantations on the lower anteriors using the bright tissue rebel implants. And so we can see the good initial stability and also the good healing on the soft tissue after 3 weeks of surgery. We can see the successful and also beautiful provisionalizations and also the final prosthetics on the clinical photos. He did the final prosthetics using the fully digital techniques, and also he used a copy of temporary prosthetics. Okay, today the Dr. Park is preparing the live surgery on the lower anteriors using the bright tissue rebel implant and also the OSTEON Xeno Collagen bone graft materials. Okay, look at the live surgery with us. Okay, he started his surgery. Now he is doing the tooth extractions on the lower anteriors. I think he needs more anesthesia because of the bleedings due to the severe inflammations. We can imagine there's much granulation tissues inside the gingival flap. We can see the mobile tooth is extracted very softly. And also we can see the much granulation tissues in the extraction socket. And also we can see the pus discharge around the tooth. Okay, he did the tooth extractions perfectly. And now he made the particular incisions on the major size of tooth number 44. And also he cut the proximal portions. And also he makes particular incision, the major part on the 33 tooth. Now he tried to separate the gingival flaps from the extraction sockets. So we can see the much granulation tissues because it had severe inflammations for a long time. So now it is a chronic conditions with chronic inflammations. So like these conditions, the chronic inflammation conditions, we can think that it is possible to place implant immediately after the tooth extractions with the severe inflammations. So if you remove the granulation tissue perfectly, I think it is okay. So now he is doing the procedures of immediate implantations using the right tissue level implant. I think that in these chronic inflammatory conditions, the removal of the granulation tissue is the main time point and main procedures for the successful place implant. So we can see the loose granulation tissue is sucked on the suctions pressures. And now he is trying to separate the gingival flap from the granulation tissue and also the buccal bone. So I think that this procedure to remove the granulation tissue is the RDS on the immediate implantations. RDS means the right determination state, right? So now he spent much time to remove the granulation tissue perfectly. And also we can see the secondary caries in the medial side of the tooth number 44. So I think he will do the new crown on that tooth. So the granulation tissue is very tough. So he is trying to remove that. In the inner side of the extraction circuit. Now he is detaching the granulation tissue with the hemostat. And now he elevate the gingival plane more with the surgical elevator, peristyle elevator. I think there's much bleeding on the canine positions. Okay, now we start the drilling. On the 32 positions. Now he measured the depths with the depth gauge. No, with the drill. I think we can imagine he will use the 10 millimeter rings implant fixtures. Okay, because it is very narrow reach and also the lower anteriors, just once drilling, he did place the implant perfectly on the tooth number 32 positions with the bright tissue level implant. And we can see the severe bone defect on the around the tooth number 43 positions. Now he started the drilling on the side. Because there's some slope on the defect side, so it is very difficult to make the initial drilling. But because he is professional, he can do. Good, he can do like this. And also we can imagine that he will use the 10 millimeter ranks textures. Great. So like as the 32 implants, he did it just once drilling, and then now he placed the implant. I think he increased the torque. Now he do the levers. Check the depths again with depth gauge and also the drill. And place the implant again. Okay, it looks great. So we can see the position is perfect and great. And he make more insertions with the top wrench for the more rigid initial stability. And also we have to think and consider the alveolar bone resorption after the tooth extraction in the immediate implantations. So it is important to place the implant picture more deeper when we do the immediate implantation. Now he is checking the flexibility of the gingival flap. I think he will do the GBR around the implant picture because there is some picture thread exposures, especially on the 43 positions, because there's severe bone resorptions. Yes, we can see the picture thread exposures on the sides. Okay, so he decided to do the bone graft around the pictures. And also we can see the rough alveolar bone between the two implant pictures. I think he will do trimming great with the bone ronger. And maybe he will use the autogenous bone for the bone graft. Yes, he trimmed the bone well for the smooth bone surface. Sometimes the sharp bone defect makes the pain to the patient after the surgery. So we have to trim like this. Okay, now it's time for the GBR. Good. He is using the OSTEON Xeno collagens. Look at this because it looks like as black bone, but that is not a black bone, but because it has the collagens, so the bone particle is entangled with the collagen fibers, so it is very easy and simple to apply the bone graft materials around the implant picture like this. We can just apply the pin set like this. So it is very easy and simple. Just put the bone graft materials and then put down the materials with the instrument, right? As the peristyle elevator or the pin set. Any tool is good. Now he is trying to disconnect the cover screw and then connect the healing equipment. So we can see the perfect positions of two implants for the prosthetics on the lower anteriors. Okay, now he is connecting the cover screws and healing abutments. And also do the same procedures on the 32 positions. Now he is making sure the flexibility of the gingival flap for the covering the bone graft site. Now he is preparing the collagen membrane. I think that is collagen membrane too. He make the shape for the proper coverage on the bone graft site. implant covered with the gingival flap. Yes, now he is starting the suturing. I think the suture material is the 5-0 machine. We can see the good primary closure around the filling abutment. Now he is finalizing the surgery with the suturing. And his suturing is very beautiful. And also from the tooth extractions, it just takes 10 minutes or 15 minutes. It's very quick, right? So he is very professional. Because he made the flexible gingival flap after the granulation tissue remover and also makes them releasing the gingival flap. So we can see now he can get the primary closures after the immediate implant placement. So I think he will do more string right in the vertical side. So as I mentioned you, it just takes 10 or 15 minutes from the tooth extractions to the suturing. So I think that it was possible using the right tissue level implant because it is very good for the initial stability on the immediate implantations, and also it has the simple drilling procedures. So it can reduce the time for the surgery. So it can make us very convenient and also to the patient with the rapid surgery. Okay, now the surgery is finished. So for the preparations, the X-ray and also CT images, we need the break time. So after the break time for the 10 minutes, we will have the Q&A time. So see you soon. Okay, the operation is finished well, and also the patient got the radiograph, the panoramic view, and also CT. So we can see the panoramic view, and the implants placed well, and also the scan abutment is connected well for the prosthesis of the provisioner and also the pinner prosthesis. So we can see the string is very good and the surgical site is very clean, right? And also we can see the implant is placed on the center, the leech. And also we can see the OSTEON Collagen bone graft was successful, right? So I think today's surgery is very perfect because Dr. Jung Park is professional surgeons. So we got the questions about the bright tissue level. The question is which case is good for with the bright tissue level implant. I think that as I mentioned you before, the bright tissue level implants make us simplifying surgical procedure and also the prosthetic procedures because it has a thin and deep thread design. I think it is very proper for the immediate implantations, and also after the detaching the mount and then connect with the scan abutments, it can reduce the time for the provisioner prosthesis, and also it can reduce the minor prosthesis. So it is very useful for the immediate implantation, also immediate loadings. So today's the right surgery is done, and also I hope you guys have a great time, and also this right surgery can be a help for your dental treatment for your patients. And thank you for watching today's right surgery, and the next right surgery is in June. So see you next time. Thank you.